Hello everyone, and thank you for tuning in to today's presentation of our group project. Our group name is Team Know-It-Alls, and the members consist of myself, Will Etchells, along with Sheena Beard, Laura Mordova, and Aaron Hong. This project has tasked our team with creating a form of process improvement that we feel could benefit a healthcare setting. This presentation will be structured in a way that allows you as the viewer to understand the area of improvement that our team has identified, the measurements that we as a group took to highlight the processes that are currently set in place at the healthcare setting that we have chosen, identify the area of the healthcare setting that we as a group feel could use improvement on, and finally, present and measure the possible outcomes of the process improvement areas that we as a group feel would be beneficial to the healthcare setting that we have selected. With all of that being said, let's transition into the scope of our project. In terms of the project scope, to start, the problem area that we as a team feel could use a form of process improvement on is in the area of patient wait times. It is important for any healthcare organization to understand how patient wait times affect both the patient and the organization and the efforts the organization can make to eliminate waste in the form of wait times for the best form of care delivery. The organization that we decided to focus our efforts on is the Pacific Medical Center, specifically the Outpatient Diagnostic Imaging Center located in Seattle, Washington. Data collection is important to understand to become an effective practitioner of continuous improvement. The forms of data collection that we as a team utilized were check sheets as well as interviews, which Sheena will touch on in just a moment. According to McLaughlin and Olson in Chapter 7 of this class's textbook, check sheets are custom-designed forms that allow users to collect data on problems and defects, and the form has checkbox items that describe typical problems in the system. Check sheets are designed to collect data in real time as it's being created and are a necessary data tool used prior to conducting any analysis. Interviews were also conducted to gather baseline data surrounding the issues regarding patient wait times. Sheena will also be discussing the team's improvement operation strategies, including the 5 whys as well as a fishbone diagram. Next, Laura will be discussing the process improvement strategies that we as a team decided to focus on, which are communication, advanced access scheduling, and appointment grouping, and be discussing how these strategies can ultimately reduce patient wait times in the Pacific Medical Center's Outpatient Diagnostic Imaging Center. And finally, we will have Aaron summarizing and concluding the presentation. Again, thank you all for being here today. Now I will pass the presentation along to Sheena.
Hi everyone, my name is Sheena and I'm going to be talking about data collection. Thank you, Will, for the great introduction to our process improvement project. So the data that I collected was from Pacific Medical Center in the Outpatient and Diagnostic Imaging Center. There they focus on MRI, CT, and ultrasound. They also have X-ray, but I did not include that in the data that I collected because they have a different system as far as checking in patients. So I did not include them because I felt like that would be an outlier as far as the data collection goes. So how I collected data was from using check sheets, and then I also interviewed the schedulers and the front desk individuals that check in patients. So here is a list of the check sheet information that I collected. So as you can see, the different columns, there's appointment type and the time that the patient had to wait before they were called back for the exam. Overall, very short wait times. Something to keep in mind though is that this is an outpatient facility where appointments are made. This is not an emergency or an urgent care type of situation. So all these appointments are made ahead of time and people are given a time slot for when they should be arriving. So after collecting this data, it was determined that the mean was 2 minutes and 16 seconds for the amount of time that an average patient has to wait before being called back for the exam. As I was diving deeper into collecting my data, I decided to interview the schedulers and the front desk individuals to get some reasons as to why people have these delayed wait times. So one interview went this way, and I used the 5 whys technique. So patient had to wait to be called back for their imaging exam. Why did this happen? Because the patient had arrived late. Why did the patient arrive late? Because they were released late from another exam. This is particularly an issue with mammograms because they are actually on the opposite side of the hospital. So if a patient has a mammogram and an ultrasound, for example, they go to their mammogram, they use a completely different type of scheduling techniques, and then that sometimes makes them late for the exam at ultrasound or CT or whatever else they might have for that day. So following that question, it was like, why were they late from their other exam? And that is because they had multiple appointments that were scheduled that day. And then why did that happen? Because of physician preference. A lot of times they like to schedule everything in one day so that the results come back in a timely manner. This is a fishbone diagram that I created for reasons as to why there are wait times in the first place. As we just went through the 5 whys technique, towards the top of the screen there, you can see multiple appointments. Anytime there's multiple appointments for a patient, there is a chance of something running late, whether a technologist is behind or the patient arrived late to their appointment because of traffic. There can also be a slight delay of schedulers checking in patients because maybe multiple patients arrived at the same time. And there's also the possibility that the technologist is behind. Maybe they had to wait for the radiologist to read something before they could proceed with the next patient. Maybe they had a really technically difficult patient that was in a wheelchair and needed help transferring. Maybe there was a lot of pathology to document. So this is a great representation of how there are so many different avenues of things that can contribute to longer wait times. And next up is Laura to talk about some process improvement measures that we came up with.
Thanks, Sheena. My name is Laura, and I'll be talking about process improvement. So we decided to focus on 3 main topics for the process improvement, which are communication, advanced access scheduling, and appointment grouping. These all 3 lead back to the value stream mapping, which asks 3 questions. Does the patient care about the activity? Does the activity transform the end product in some way? And is the activity performed correctly the first time? Focusing on communication, advanced access scheduling, and appointment grouping allows for all 3 of those questions to be answered and allows for patient wait times to be decreased. Communication is key in every aspect. Having effective communication can avoid patient walkouts and frustrated complaints. If the back office staff does not communicate with the front office staff about the wait times and what is going on with the provider, it makes it difficult for the front office staff to communicate with the patients up front. If a provider is very behind calling the patients back, it's beneficial to inform those patients prior to their appointments. It's also beneficial to have a whiteboard at the front desk with wait times so patients can visually see if there's a delay. Communicating can avoid lots of frustration and complaints. A lot of the times, people just want to know what's going on. Advanced access scheduling allows for providers to control their schedules a little bit better. Having online scheduling allows for patients to get in whenever they need and allows for them to make appointments as they need. Having the advanced access scheduling blocks off the same-day appointments or extended time slots that only the people in the clinic can schedule, allowing for the doctors to have emergency appointments for their established patients and allows for more time slots for complicated appointments. Depending on the type of appointments, they can take longer than others, and depending on the patient's issues, that can also take longer. So having the advanced access scheduling allows for the admin staff to be able to make the schedule for the provider fit accordingly in order to have a more beneficial day and not go behind. Although implementation of advanced access scheduling can be difficult, it is feasible. Some benefits to advanced access scheduling are a decrease in patient no-show rates, happier staff, and more satisfied patients. These benefits in turn will increase a provider and the clinic's revenue and reduce administration costs and become fewer patients that are rescheduled. If patients are not scheduled correctly, oftentimes you are needing to call and reschedule. Patients get frustrated and complain. That also changes the doctor's day because then that takes away a time slot that could have been used, or it has oftentimes causing delay for the providers if they cannot reschedule those patients. The last suggestion we had for our process improvement was appointment grouping. Our suggestion of grouping appointments is when a patient has multiple appointments back to back, or spouses want to come in back to back, grouping their appointments, allowing for one longer visit. When the scheduler is aware of multiple appointments, they can schedule back to back off of one another, which gives the patient a shorter wait time and the provider less work when charting. Allowing for different appointments to be booked together also allows for the providers to have different appointments gapped out throughout the day. Allowing for that allows for less wait time. If there are more complicated patients, spreading them out throughout the day and grouping those appointments that are similar allows for the provider to have a more day that's not as staggered. Appointment grouping is different than double booking, which is a notorious contributor to longer waits. By grouping the patient's appointments, the service providers, such as technologists, can work together to transport patients from one another, making it an effortless visit that is highly efficient. If a patient needs multiple things done in one visit, it's easier to group those appointments from the necessity from the highest to the lowest. Allowing for that allows for better patient care and allows for the value stream mapping to be notified. If all three questions are answered and the patients are satisfied, then the process has been improved. And next to talk is my teammate, Aaron.
Thank you, Laura. Hi, everyone. My name is Aaron, and I'll be wrapping up this presentation. So, in summary, our team decided to focus our project on improving wait times. So, of course, sometimes waiting is inevitable, but one of the main goals for any healthcare organization is to find ways to continuously improve patient satisfaction and the workflow of every department. Patients sometimes wait months for an appointment and will arrive expecting their medical needs to be met. So wait times can really be frustrating for them, and sometimes they might even choose to leave because of the long waits, which then leads to them not receiving the care that they need, and then complaints towards the department could start building up. So, like we stated before, we specifically wanted to gear our work for this project towards 3 process improvements that require standardized work. The first improvement process that we suggested was establishing effective communication between healthcare staff and patients for their upcoming appointments. The second was utilizing advanced access scheduling, which helps decrease no-show and rescheduling rates, and it also helps increase revenue and reduce administration costs. And the last improvement was using appointment grouping, which helps promote better coordination of care between each of the departments that the patients might have appointments for, and it also minimizes transporting and time waste. Thank you for listening.